So I recently just quit my job as a physician, and I'm really happy about it.
So as a physician myself, I wanted to comment on this video really quickly. Now, I've been employed. I've worked in the urgent care setting. I've worked as a hospitalist. I've worked in the ICU. I've worked in the ER. And I also worked in fellowship in academics. And I'm also right now a private practice owner of a weight loss clinic and an allergy clinic. So in the video, he mentions how he's quitting medicine because essentially he's being taken advantage of. He's saying that these large corporations are overworking doctors and underpaying them, and essentially the doctors are starting to burn out because they're kind of working in this conveyor belt like medicine where they don't have good autonomy, and it's not why people got into medicine in the first place. And he was saying that it's unbelievable how much doctors are taking advantage of, and I 100% agree with that, and I'm going to explain why that is. The moment you start medical school, you start being taken, you start getting financially taken advantage of because of the lack of expertise doctors have in finance, in insurance, in understanding money, and they really just understand science. A person starts medical school and they'll know more about the Krebs cycle than they'll know about the debt they're about to undertake, or what an APR is, or what the interest rates are they're about to go into just to go into medical school in the first place. Medical students or pre-meds are convinced about the tier of the medical school they're about to go into, and they don't really look at the price of the medical school they're going to go into, and they don't realize that they're going to have to pay that back 10 to 15 years later at these elevated interest rates. Literally nobody will explain this to you. You might take like a 20-minute course on loans at one point in time when you're about to take on like $300,000 to $350,000 in debt, and the assumption always is the doctor will be able to pay it back because the doctors will have high salaries in the future. The problem is the doctor graduates around the age of 35, so they have to start a family, they have to buy a house, so they immediately have to accrue way more debt while they're already dealing with the debt that they dealt with. So they have this double whammy because they also lose a decade of work during their lifetime. Once you graduate your residency, no one teaches you how insurances work or how contracts work, all that stuff. The first time you get your contract, you have to get lawyers to review it. You have no idea how this works. So once you start work, you have to find a job that can take advantage of you at times because you just need to find some place that helps you pay off these loans. So you kind of walk around with these golden handcuffs. Doctors have a hard time opening up their own practices because they're in so much debt that taking the risk and not getting income for 1 to 2 years will drastically put them back on their loan payments. So they're forced to do jobs they don't like. You know, a doctor asked them, if you graduated with no debt whatsoever, what would you have done differently in your career? It's probably way different than what they did right now. And to be honest, large hospital systems and healthcare systems are advantaged for doctors' lack of financial literacy. It's better that the doctor doesn't know how much everything costs you as a patient when they order it, because then they might not order as much stuff. So my advice to future doctors is become financially literate as fast as possible. It's better for you and it's better for your patients. Understand insurance, understand contracts, and understand drug prices. Hope that helps.